This is Beyond the Reps, where we discuss any and everything related to health, fitness, wellness, and performance. I am your host, George Griffith, ACSM certified exercise physiologist, and I'll be bringing my 27 years of experience to engage with guests to bring you education, motivation, and inspiration. One of the key roles in athlete management is the physical therapist and the team surrounding the physical therapist. Often overlooked, without the right treatment team around an athlete, they very often don't get much success in their sport. And today, I have with me one of the best physical therapists in Barbados.
Okay.
Ms. Marita Marshall. Ms. Marita Marshall, how are you doing?
I am fine.
Well, thanks for coming on the show.
Thanks for having me.
It's been a while.
It's been a while.
Tell the people at home what you've been up to.
That's interesting. I've been up to a lot. I've been traveling a lot for work. And I have actually been quite active. I just did the open water, Barbados Open Water Festival.
Okay.
That was my first time, and I am very proud and happy about that. I was looking forward to it all year. And I also did the Wanna Be Fit events recently.
Right.
A swim and a run.
Okay.
So proud about that as well. So trying to become a budding triathlete alongside everything else, So yeah.
Okay.
Busy.
Well, congratulations on your personal fitness journey.
Thank you.
Right. So tell the people a little bit about your background and how you got into physical therapy and how you're doing what you're doing today.
All right. So where to start? From the beginning. Basically, I always had an interest in medicine. I wanted to be a doctor initially, and kind of changed my mind from that, but wanted to stay within the medical field. Okay. And I always knew I wanted to work with people and help people. And I had to do some volunteer hours at the hospital to apply for the program. And after doing those, I really recognized that physical therapy is more than just sports, because that's what most people will know it to be.
Right.
There are a lot of other dimensions, and I really learned that during the volunteer hours at the hospital. And then, my journey started. I went to Mona, did my first degree, came back, worked for a bit, did my master's in Scotland. And then from there, after completing my master's, is when I would say I really started to get super busy in terms of traveling with teams and so. So after that, then I would have started working with the West Indies women's cricket team. Did that for like 2 years. Traveled quite a bit with them. And then I moved back home and I started my own practice. So Pops was up and running from then. And then COVID came and we were all like, oh my goodness, what is this? What's going to happen? Who knows? But was able to ride that through, had a decent year despite that, sorry. And actually coming out of COVID or right before the COVID period, I was supposed to go do an interview to start working with the Women's Tennis Association, or WTA. And I remember I had my flight bill, everything sorted to go to Miami Open for this interview, and literally everything shut down. Right. So again, like just starting a new business, prospective new, big job.
Right.
And this thing COVID came and just everything was halted. But like I said, was able to get through that, and things opened up slowly. And fortunately for me, when tennis restarted, that would have been now in 2021, I think. They reached back out and asked if I was still interested, and I was able to do 2 tournaments in Dubai and Doha. And I think they kind of give me like a on the ground background kind of interview, I guess. I don't know. To see, let's throw in the fire, let's see how she works, and then decide if you really want to, carry on with a formal interview and see. So those 2 tournaments went pretty well, and then went through the whole process of the formal interview, and then, believe it or not, 2 years of training. And when they said to me that it's gonna take like 2 years to get into the whole system,
right,
I was like, 2 years? What do you mean? No chance.
Right.
But it really, they have a unique system that is specific to the WTA.
Right.
And it just takes time to learn all the rules, to learn all. I had basically had to relearn taping, like
Okay.
their way of doing everything. And obviously to give the athletes that we work with consistency, because it's not every time that a player walks into the training room that they're going to see the same person.
Right.
And you have physiotherapists from all over the world and people with different, backgrounds and different ways of doing things, but everybody needs to be seen in the same kind of way. So eventually I understood.
Right.
So finished that. And then by then Pops is pretty much up and running, moved into a new space. And since then, that's pretty much been my life.
And the rest is history.
Yeah, the rest is history. Exactly.
Tell me in one sentence, what is physical therapy?
So, physical therapy in one sentence. Physical therapy is the use of physical aids and the hands to help persons recover from injury, illness. I'm going to stop there.
Right. And like you said, most people, when they think about physical therapy, they think about treating athletes, treating injuries.
Yes.
Maybe somebody had a car accident and had to go to physio. But as you said, it's a much broader spectrum of activities,
Definitely.
Right? List some of them for us.
So there is orthopedic, which is the most common. So that's the persons who fracture a bone. That's the persons who have lower back pain, neck pain, anything what we call musculoskeletal.
Right.
So muscles or bones. And then there's cardiopulmonary. So those are persons who might have a pneumonia, who might have a lower respiratory tract infection. And those persons are often seen within a hospital setting and persons within the ICU as well. So physiotherapists in that realm are actually very important in terms of making sure that the person's heart and lungs are functioning properly, their airway is clear.
Right.
Then there's neurological. So those are the persons that might have a traumatic brain injury, who might have had a stroke, who might have had anything to do with the brain, right? And the nervous system. And then there's new emerging fields like pelvic health. Okay. And that some people tend to think about only women's health when they hear pelvic health, but pelvic health is for both women and men. Right. And then there's geriatric physical therapy that focuses on the aging person. What else do we have? Oh my gosh, so many. Yeah. They're like pediatrics, right? Cerebral palsy. Oh my. They're like, I could go on.
Okay, don't.
There. But there are a lot of areas that,
absolutely. And you have decided to focus on mostly musculoskeletal?
Yes. So my focus is sports medicine, sports rehab. And recently I have found an interest in chronic pain. Okay. Because I found that is a group of persons that, people have tried everything, they've done everything, they've seen everybody, they've done everything, and then they somehow end up with me. And it's always been intriguing for me, that solving patient. Yeah, exactly. Solving the puzzle and figuring out this person's pain that nobody can get sorted. So that's a new area for me that I've recently, I forgot to tell you, I'm doing my doctorate.
Oh my.
Right, yes. Pursuing my doctorate, should hopefully be finished by next year summer. Okay. So add that to the plot.
Wow.
Yeah.
Busy. So describe for us the landscape of athlete management in Barbados from your perspective.
Okay, so athlete management in Barbados. I think when an athlete gets to the stage of being a national athlete, they do tend to, in most cases, have the support that they should, even though it should be better. It could be better. Right. And at the very minimum, that's going to be a doctor, as well as a physiotherapist and a massage therapist. Right. At the very least. We do have support for the Olympic sports, the BOA, and then the Barbados Sports Medicine Association, which basically has a group of registered and qualified medical practitioners from those areas that I just said to you: doctors, physiotherapists, chiropractors, podiatrists, massage therapists, nutritionists. So the BSMA is a hub for those professionals who are recognized locally, and athletes do have access to those persons. However, I feel like, okay, we recently had the Barbados Sports Medicine Clinic that was launched, I think last year sometime.
Okay.
However, it's only been kind of pilot scale. So the BOA has funded athletes. I don't know if you know. I think it's called Project Podium.
Right.
So they have a few athletes. They have a number of athletes who are earmarked and who receive funding, who will naturally have access to some benefits.
Right.
Right. And the Sports Medicine Clinic is one of those. Now, for physio in particular, it's difficult to be within that setting and work voluntarily because you could, as a doctor, you could see, if you have an injury or something happen, you could go and see any doctor and the doctor could follow up. But if there's an athlete that gets injured, right, that needs rehab on a continuous basis, you can't go one Saturday and see one physio. Then next Saturday you see somebody else. Then next Saturday, you back to the first person you saw. So there needs to be continuity. So all I'm trying to say here is
before you go on though, is it not what they do in the WTA?
But it's different.
Tell me how it's different.
It's different because we are treating within WTA is more acute.
Okay.
Yeah.
Right.
So they actually call us primary health care providers in the WTA and not physios. That's our title because we are literally the first contact for most things.
Right.
On most occasions.
Okay.
And why they focus so heavily on our training is because we are contracted by the WTA. However, at tournaments, there are doctors there, but these are doctors who are what they call kind of local doctors, right? So these doctors might come and might not be very au fait with sports medicine, right? So when things happen, we need to be able to recognize if it's a skin issue. We need to have the knowledge on certain things. Obviously, the doctor we consult with, but we're much that broader, primary,
much broader scope.
Exactly.
Right.
So it's a little bit different when we're talking about primary care or acute care versus long-term rehab.
Right.
So spinning it back to Barbados now. If it would be nice to see the clinic up and running is what I'm trying to say. But to get it up and running, I think we need to develop a hub of professionals who are going to be hired to work within the system.
Right.
For it to function how it should. In Trinidad, they have their big hub of psychologists, physiotherapists, doctors that athletes can go at any time and get whatever treatment that's needed. So
right now, it's voluntary?
Yes.
Right.
Yeah.
And you think there's too much variability amongst the physios as far as training is concerned?
Yeah. For the rehab side of things. Yeah.
So Marita Marshall's in charge. Doctor
yes,
Marita Marshall by next summer.
All right.
You're in charge. How are you going to frame things? How are you going to set it up? What are you going to do?
Well, for me, oh my gosh, there's so many things. It's a big.
Give me three. Don't
it's a big plan of restructuring, right? So first and foremost, we need to get the in-house in order, right? So everybody needs to be upskilled.
Right.
All right. So we need to have a series of training for our local practitioners and clinicians to make sure everybody is up to par. Everybody is comfortable working in acute care, working in emergency medicine and coverage, and then in the rehab side of things. Right. So it's those three areas that need to be sharpened up. And then I would to get on BOA's backside.
Right.
And I would tell them, listen, to have this clinic running, we need posts. We need to hire at least one doctor, at least one physio, maybe a part-time massage therapist and a no, you can't have a part-time psychologist. You need a full-time. You need both. I need 4 full-time posts.
Okay. Where is the money coming from, though?
Wherever BOA gets money from,
right.
tell the old IOC we need some more.
Right.
Because
serious conversation, no.
Listen, because we need to get this clinic up and running, and we need 4 posts at the very minimum to get it running.
Right.
Good. IOC says fine. We sending you how much have I ain't do the math.
Right.
Whatever money it needs, we need to get these people hired and paid on a monthly basis.
Right.
Right.
If you're gonna do it properly.
Exactly.
Right.
Right. So everybody's hired, and we know we're going to continue working with the pilot group. So we still sticking to the podium athletes, maybe extend the scope a little bit to the athletes who fall just outside of that.
Right.
Right. And we are going to create a calendar, right?
Okay.
For the year.
Okay.
We are going to schedule in our pre-participation examinations and medical screening. And we're going to schedule in the entire year of all the athletes scheduled for the different sports. Okay. Right? And we're gonna have a functioning medical record system.
Okay.
To keep this data, because we can't be writing on paper in 2026. This is next year we're talking about, right?
Right.
2026, we ain't writing on a scrap paper that can get lost, that nobody can find, that blah, 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 blah. You know what I mean?
Understood.
So we want a functioning system.
Right. There isn't one currently?
I don't know what to say.
Tell me the truth, man.
I don't know. I haven't checked recently. I don't know.
The last time you checked?
Last time I checked, it wasn't functioning at its best.
Right. Who's responsible for it?
Listen, George.
I asking you questions. You can't come in here and tell me. I asking you questions.
No.
Okay, so you don't know who's responsible. Okay.
You go and research that. I am not sure.
But you're the one inside the industry. So I'm trying to find out from you.
I know that one. I honestly don't. I'm not sure.
Fair enough.
But where was I? Right. So we got the system up and running. We've done the screening, and obviously in the screening we would have picked up athletes that have had injuries that haven't been managed or mismanaged that need to be kind of cleaned up.
Right.
Stuff that we think could be projected for possible injury that we need to work on. So we're gonna get right into it, start working on those areas. Athletes then have scheduled physio sessions, scheduled sessions with psychologists, scheduled massages, and intermittent reassessments with the team doctors, sports medicine doctors. And in an ideal world, that would be great at the bare minimum.
Okay. So
in an ideal world,
I'm with you. Definitely with you. Obviously, I'm not part of the sports medicine continuum, although I think sometimes after rehab into community care, personal trainers and coaches should be there as well.
Oh, definitely.
Because very often, post-rehab is just varying degrees of strength training as far as I'm concerned. But let us talk about the recreational athlete a little bit before we come back to something that you said earlier, because they don't necessarily have access to all these things in one hub. Yeah. Right? If I'm a guy who's, 35-year-old guy who's still out there training to keep fit for my longevity or whatever, and I go out there and get injured, where do I go? How do I access your services, for example?
Okay, so I don't even know what to say. By law, you're supposed to have a referral for physio from a medical doctor for physio. Don't ask me where to find this law, this rule. I don't know where it is. First of all, I don't know who monitors it.
Right.
So by law.
Right.
However, if you are casually injured, I would say, sorry, doctors, not knocking you or anything, but most general practitioners, musculoskeletal injuries and orthopedics is not their primary everyday thing. They said they write their prescriptions for their viral illnesses and their so forth. Fine, no problem.
Right.
If you're not able to see a sports medicine doctor, and we only have two, three, a couple, less than 5 on island.
I know. One of them is our next guest on the podcast.
So if you're not able to get in to see that person, your next bet would be at the very least a physiotherapist.
Right.
No, again, not all physiotherapists are their primary area or their area of specialty is not sports medicine.
Right.
However, physiotherapists are qualified and very good at assessing musculoskeletal. Right. That is our area. That's our thing. So even if not, that person should at least be able to give you a good assessment and guide you in the right direction.
Right.
Right. So, I mean, there's loads of physiotherapists on island.
Right.
Just Google physiotherapist in Barbados.
Right.
Oh my gosh. Loads. Have your pick.
Right.
Whichever is closest to you, whoever you know, just go for it. So that's the start.
What percentage of your patients have actually gone to a doctor before they come to you, do you think?
Quite a few do. There are also quite a few who are repeat, right? Okay. So they already know, and if anything happens, they just come because they already know. Right. And I think I had a patient maybe last week or so that told me, I love physiotherapists, I wish more people knew. She had some injury in the past and she just broke her ankle and she's right away onto physio.
Okay.
Yes, I'm like, I wish more people were like you,
right. Uh-huh.
But yeah, I think it's maybe 50-50.
Okay.
Yeah. Mm-hmm.
Right. So this law, this rule that we can't find.
Yeah.
Mm-hmm. Nobody's enforcing it, really.
Nope.
Nobody. Right.
And on that note, a point of, oh my gosh, constant headache, my head is hurting me already, right, is the fact that we have people out there, like for instance, I'm telling you, I'm doing my dots right now. There are people out there that don't do nothing up and do 1 or 2 massage therapy courses, right, and about the place throwing about this therapist word, like if right, I'm this therapist, you doing all this rehab, where have you studied, sir, ma'am?
Okay, so we need
regulation.
So there's no regulation?
There's supposed to be, but I mean, no, not really. Truthfully, no. We pay our money every year to the paramedical council to register. Mm-hmm. However, that's it. You pay your money and that's it. You get a certificate, but the
right. So the organization in your mind has to have some teeth as well.
Definitely.
In order to protect the client.
Thank you.
Patient,
yes.
Mm-hmm. Right. Okay. Mm-hmm. So this is another thing that Dr. Marshall is going to work on?
This is another thing that I hope in my lifetime, within the next 5 years, that I can see some changes, because with the access of social media now, you're seeing more. Right. And you're having people come and say, up to 2 days ago, this person hurt their wrist, went to see some person, and they put the embark in place. And I'm just like, but what's wrong with your wrist? Oh, I don't know. Who's the person that you saw? Name so-and-so that was a bodybuilder that's do-da-da-da. And I'm just like, oof. But who's this person? Like, what are they? Right. I don't know. You don't know, but they put him back in your wrist. What's wrong with your wrist? Did this person tell you what's wrong? I don't know. Please help me.
Right. Understood.
And we have a lot of that out there.
So scope of practice is a major issue.
Major issue.
What do we do about it?
Honestly, I don't know, because I don't know. I really don't know, because the lines are so blurry now. It's like you go do a massage course and then everything is easily accessible now. So things that maybe a physiotherapist only would have had access to now is online. Right. You could sign up for any course that you want. Mm-hmm. You could do whatever if you choose to do it, and then come back and throw some things on you.
Or you have to do this online on the back of your t-shirt.
Therapist on your shirt, and you could put e-stim on somebody. If you feel bold, you could drop needles in people.
Right.
Because some people I would never. Like, I can't do it. Right. Like, you know what you're doing?
Right. Okay.
But the people still go,
Right.
and then when it don't get better in 2 months, then talk to a friend and talk to somebody, and then say, well, you need to go and see this person. And come in my office and tell me I had this issue for the last 5 months.
Right.
And I went by so and so and so and so. Who is so and so? I don't know, but so it ain't better, so I hear.
Understood. Okay. So there's some issues out there that we need to be considering across the sports medicine community. Right. I'm going to leave Dr. Marshall to solve those, obviously, and I'm going to bring it back now to athlete management before you blow gas.
We should change. Yeah.
All right. So tell me about the most common injury ailment you're seeing amongst athletes across the various disciplines, and what one or two things they could do to maybe prevent some of those issues popping up in the first place, or at least manage them a little bit better.
That was a hard question. Athletes, or you mean in general?
In general, yeah.
Because in general, it would definitely be lower back pain.
Low back pain.
Right?
85% of the population.
Lower back pain.
Right.
I would say there's still a lot of people that don't understand how either repetitive task in work, poor posture, or poor ergonomically set up spaces, and not just for the not just for a person that's working at a desk. Those two areas for sure. And then stress. Persons don't recognize how either of those contribute to their either back pain, neck pain in general.
Right.
Yeah, I think I would say lower back pain for sure.
So let me do you the typical personal trainer thing. You come to me, low back pain. I'm like, the core weak, hamstrings tight, glutes weak.
Yeah, exactly.
There we go. What do you think?
No,
Tell me.
Don't be careful. You sounding like them ones on the streets that just go to the automatic.
Correct.
You know,
Your hand is a hammer. Everything looks like a nail.
Oh my gosh. But no, seriously. I tend to start to delve a little bit deeper into looking at what the person does for work, asking a few questions into what's going on in life otherwise, because they don't make those connections. Right. And then you might hear, oh well, so and so passed away.
Right.
This, and then that opens a can of worms for a whole set of unraveling of stuff.
Right.
And then on the other side, there's persons who, even circling back to the same medical field, because up to today, I had a anesthesiologist come in to see me with shoulder pain. And she was like, yeah, my left shoulder is my bread and butter. And she was explaining to me how she has to use her left arm to do basically everything. Right. So you get overuse and then still not making the connection that, that over a repetitive stress, a repetitive action is what might be contributing to the pain. And then when I dive a little bit deeper and say, okay, well, how do you stand? How do you hold the stuff? And then we say, okay, well, maybe if you position yourself in this way, or if you were able to raise the table higher or, lower, whatever, then it would kind of reduce the strain on your actual body. So, it's all about knowing and understanding. I guess it comes with experience too. The right questions to ask the person, versus just jumping to, well, it has to be just randomly. Your glutes are tight, or your core knees were, I mean, you have to all do with a little bit more core work. So I guess it works, but yeah, those three factors are stuff that I always focus on in terms of diving down a little bit deeper. Yeah, exactly. Correct. Like, something though.
Feeling okay, but here, what is going on?
Definitely.
Okay. All right. So manage the entire patient.
Correct.
Don't just try to isolate one thing. We have to look at it holistically when we're treating somebody coming to you with injury, ailment, or whatever.
And that goes for athletes too, because even the athlete with the hamstring strain, that every time they go back to keep straining this particular hamstring, we gotta sit down, we gotta have a little heart to heart, a little eye to eye. Let me talk. What really going on here? Is there something else? Is there a mental block somewhere? Without saying it like that, but for the younger athletes, you have to kind of unravel them a little bit. And then when you do get in, there's some fear.
Right.
Yeah. So it's across the board.
But how is it really possible? Possible is the wrong word. But how practical is it when all these different health professionals have to be in constant communication with each other, sometimes around one particular athlete, right? Especially in a situation where, as you say, these people aren't for hires at the clinic, but I have my practice over here and I do some work for the BOA. I have my practice over here. I do some work for the AAB. And so we may not be communicating every day around this particular athlete. So when I'm treating, the soft tissue, somebody else is looking at the nutrition, but we don't know necessarily what's happening from the mental coaching perspective. How are we ever going to get success with the athlete?
But that's a problem because we have to communicate. And if we circling back to the athlete now, we have to communicate.
Are we communicating?
No, we have to.
But are we communicating?
We aren't.
Right.
But we have to.
Right.
That's the only way.
Right.
So
the first step to that is what?
I think you just have to do it.
Okay. I understand that you just have to do it, but it's not being done, right? So, Dr. Marshall.
Back to Dr. Marshall. Let's put it out there. Yes.
You're in charge again. Is this part of the data collection module, or is this something else when it comes to the communication amongst the other healthcare professionals?
I think there's a little bit too of a little bit of crabs in the barrel mentality, a little bit of I want to be the winner, I want to get recognition, a little bit of that, right? Locally, that we have to get over as well when it comes to communicating effectively, because it's not going to work if we're not doing it, and it's not working.
Right.
We have to take out the ego, like strip down the ego. It's not about you. The athlete is at the center. The individual, the patient, whoever is at the center. It's not about me.
Right.
I don't want any praise. We're here to work as a team for the betterment of the athlete or the patient. Right? That has to be the focus. So
it's amazing how far we can go if nobody cares who gets credit, right?
Right.
Right.
But everybody wants to be that person who, is recognized for bringing this person back, or, making them faster, or, getting that medal, getting that PB, it was me. No. It was a team. And it was the athlete. Yeah. It was everybody. Yeah. Everybody has a part to play.
Yeah.
So, and I actually know that you raised that point. It just, I have been fortunate to be able to be in so many spaces internationally that it really grinds my gears every time I come back. And it's like, we could be so much further if we just work together. We could be so much further if we shared information more and not just gatekeep. I've been in many spaces with people who are, oh my gosh, you think I am amazing? These people.
I don't think you're amazing.
You don't?
I'm just kidding. Of course.
No, but seriously, I've been in spaces. These people are 100 times like proper people. CVs 30 pages long with
and giving and sharing.
Sharing successes and failures.
Right. So what is it here? Do you think it's just that the market is small and people are competing for a small share of the pie?
I don't think so, because we have enough. Okay. There's enough to go around. I really think that everybody just wants to, I don't know, ride a wave of glory to the dead or something. I don't know.
But there's got to be some reason why we're different here compared to other those places. You haven't been able to put your finger on it?
I've been trying to figure it out. And I think for me personally too, I think that's what really gets me into not the best space mentally, because I feel like I have so much to offer. There's so much I want to share, but then you get like this kind of push back. Like,
push back from where?
I don't know, the people that currently in these places, in these spaces. I don't know.
Right.
So I just keep it to myself. But then exactly. Because that's not me, I want
and not only is it not
make things happen.
Personality, but this extended training path that you're on, you have to be an educator. You have to be a leader
Definitely.
in the field.
Definitely. Exactly.
So you have to find a way to engage these people, get them on your side, and help move the industry forward for the benefit of the athletes.
Really, really, really trying. I ain't figure out how yet though. I honestly, I ain't know how I can do it, but it has to be done. Somebody gotta do it.
Yeah, you're gonna do it. You're gonna find a way.
All right, we can find a way.
So let's talk now about the insurance thing, because I think I hope I'm not like bringing tales out of school, but I think there's a situation where sometimes people get injured, soft tissue injuries, and they will stay in physio for
oh my
year.
gosh, don't start me on that.
They'll stay in physio for a year. When, we hear that most soft tissue injuries are somewhat resolved within 6 to 12 weeks, but they never seem to get into community-based strength and conditioning or health and fitness setting, and they're still in physio for a year. Can you explain that?
So what I'm going to say here is that in everything in life and everything in this world, there's good, there's bad, there's indifferent, there's in between, right? And then there's people that don't know no better. Or, just don't know no better.
Right.
That also really frustrates me.
Okay.
Because actually one of our lines on our website, on our POPs website, says, we will not see you for longer than is needed.
Okay.
Right? Our goal is to get you in, figure out what the problem is, educate you on your problem, rehab you, teach you how to prevent recurrence of that particular injury, give you the confidence, grow your wings, and tell you, go now, fly off, get out of this nest on your own, whether that is on your own or, like you were saying earlier, being referred on to strength and conditioning coach, being referred on to psychologists, being referred on to whomever,
right,
or off into the world on your own.
But
unfortunately, there are people, places, spaces who, for whatever reason, I don't know, you'd have to ask them, because that's not my model, that's not what I do.
Okay.
Why somebody with an injury that would typically take 6 to 8 weeks, 12 weeks, maybe max. Every person is different, give or take another 2 weeks. Why somebody doing rehab for 8 months for saying that should be done in 3 months? I don't know. That's not my model. You're going to ask them. I ain't sure.
Okay.
So that's as much as I would say.
Understood.
But I do think that in terms of understanding for athlete, circling back to athlete, was required, because even in rehab, you will find, again, if you don't have the right professional who is specialized in that area, the rehab might look a little wishy-washy. You gotta challenge an athlete.
Right.
And it still upsets me to this day, to this week, today, when you have athletes that get injured and then a doctor or somebody, whoever, because physios do it too. You gotta rest, you gotta stop training completely. No.
Right.
No, this is an athlete, and it gets worse the higher you go when these are people who this is their livelihood.
Right.
No, they cannot stop. Right. So I will draw you in if it's unsafe. It's my job to make sure that you are as close to fit to perform your sport, to play your part, do whatever it is, as safely as possible, and allow you to perform as close to your best with whatever it is. Athletes will generally always have something going on. They can't stop. And if it's that's how you make money, definitely. We gotta manage you, unless it's like the person has surgery, obviously, it's a different kind of thing. But an athlete with a shoulder injury, why you can't continue going to the gym and focusing on lower body stuff? Why you can't continue doing core stuff? You got ankle injury, what happened to the rest of the body?
Well, it's funny to say that, because I've recently been working with a client who, doing the most basic movement, ruptured their Achilles tendon. And so my first response was, okay, once you get in the boot, or once you've seen your doctor, you've seen the physio, let's keep going with the program. We will just adjust the program, work the upper body, keep you on cardio, put you on the bike, just not have you weight bearing on that foot, obviously.
Exactly.
But they got shut down by their...
I'm so disappointed. I would like to have a conversation with that person.
I can't.
And understand the reasoning. No. But I just mean like, no, seriously, because it's a problem.
Right.
Why?
Right.
Why?
Mm-hmm.
And I always inform my patients, when they come to see us in physio, they talk. They tell us everything.
Right.
You go to the doctor, mouth shut. Afraid to ask questions, afraid to say, why? Ask all the you come in here running your mouth. Why did you say all this to the doctor?
Right.
Oh no, I didn't. So why you coming to me telling me all of this?
Right.
The same way you run your mouth and ask me all these questions and blah blah blah. Ask your medical practitioner. Why? Challenge it. What's the reason? I actually want to know why.
Right. Okay. All right. So you're gonna solve everything for us, Marita. Big job.
As if I don't have enough on these two little shoulders. No?
Well, yeah, they're getting broader with all the swimming.
You're right.
Yeah.
You're right.
Yeah.
You're right. You're right. You're right. You're right.
Looking strong, you're looking fit.
Thanks.
So tell me now. I haven't asked you. Obviously, there's a whole pile of things that you would have had on your mind. Anything I didn't ask you that you would like to address before we close?
No, I think we're going to do a part 2, though.
We have to do a part 2.
Yeah.
Okay.
We barely brush the surface, you know?
I could tell. I could tell you have a few more things to get off your chest.
So, no, I don't really have anything to, part 2 coming. Whenever George call me.
Whenever you stop traveling.
Oh my gosh. Hopefully in 2 years I'll be done. I want to start living out a suitcase.
Do you know?
I don't know.
You don't enjoy it a little bit?
I do. I think I'll miss it. I don't know. We'll see.
Okay.
We'll see.
All right. Future Dr. Marita Marshall.
All right. Sounds good though.
Yeah, it kind of sounds good.
Kind of sounds all right.
Thank you so much for coming on Beyond the Reps.
Thank you for having me.
And we'll circle back for part 2 as soon as you're back from whichever trip you're on, so we can continue to give the people at home some information to live better lifestyles.
For sure.
For sure. Thank you.
Thank you.
If you found this podcast entertaining or educational, make sure to like and subscribe. Share it with all your friends so we can continue to grow this platform to bring you more informational content.